the Mental Health Access Improvement Act of 2017. This bill seeks to amend Medicare to cover marriage and family therapist services and exempt those services from the skilled nursing facility prospective payment system so that SNFs would be able to be reimbursed based on patient status rather than for specific services, and allow mental health counselors to bill Medicare directly for their services. Currently, mental health counselors are not covered under Medicare Part B, despite having equivalent licensing and testing requirements to clinical social workers. Allowing mental health counselors to bill Medicare for their services would greatly improve access to mental health services for those covered by Medicare. The Mental Health Access Improvement Act is a federal level legislation and was introduced in 2017 by John Katko, Republican from New York, and Mike Thompson, Democrat from California. Currently, it is awaiting voting and discussion by the Committee on Ways and Means, Subcommittee on Health. The Mental Health Access Improvement Act has bipartisan support with co-sponsors from both parties that recognize the importance of having access to mental health services to treat conditions such as substance abuse. Also supporting the bill are nationwide healthcare organizations such as the National Council for Behavioral Health and the American Mental Health Counselors Association. While doing research on the Mental Health Access Improvement Act, no opponents to this legislation were found. The United States is currently in an opioid epidemic, taking thousands of lives and costing billions of dollars. Expanded access to mental health services would reduce this financial impact by allowing people to seek treatment prior to needing hospitalization. Preventative treatment and education is desperately needed as the budget for the Department of Health and Human Services was cut by 21% for the fiscal year of 2019. Currently, when someone turns 65, they may have to change their doctors if their previous doctor is not covered by Medicare. And for someone suffering a mental health condition, this can be particularly stressful, having to find another doctor if you've already have been treated by one that you trust. For nurses, this bill does not immediately change their practice. However, expanded access to mental health services and exemption from the skilled nursing facility prospective payment system will allow more patients to have their conditions treated while at one of these facilities, creating a larger patient population, which could lead to interesting research performed by nurses that improves mental health nursing through evidence-based research. Current Medicare regulations have shown themselves to be inadequate to address the nation's growing mental health and substance abuse issues. The opioid epidemic currently going on has been labeled a national health crisis. The Mental Health Access Improvement Act is a step in the right direction that greatly expands the workforce of qualified mental health professionals covered by Medicare, allowing for those in dire need of treatment. Thank you.